to get hospitalized for COVID, waiting for cases to turn positive, versus a leading indicator that has been validated now across the country in every city that they've looked with 12 to 18 days. This is not rocket science. It's simple. It's a thermometer that connects to the internet with some predictive analytics on whether it's flu or COVID, along with a symptom checker in the app. These are the kinds of things we should deploy across the world, frankly, in my opinion. Next slide. Efficient testing. This has been one story of a disaster after another. We're actually doing less testing today in America than we were doing just a few weeks ago. The hope is that antigen tests, which are low cost, instead of $50 or $100, they only cost $5 to $15 once they're at scale, at the point of care with a turnaround time, which means from taking the test to getting the answer, 15 minutes perhaps, right? That is what we need. There's going to be a lot of these tests available. There are going to be many stories about how confusing they are. The short version of the story is, if you have an antigen test and it comes back negative, you're more likely not to have the disease. If it comes back positive, you're not so sure. That's a broad generalization, but there's a lot of information on testing out there now. Please stay tuned for antigen tests and how they will help us across the board. When you have a normal test, a molecular test, something you've heard called PCR for diagnosis, coming back 3, 5, 7, 10 days later, by that time the virus has already spread. It's less than useless. And our government has created this problem by paying people $100 for this test, as opposed to the $50 it actually costs them, and paying people even if the test results come back 3 or more days later. They should not pay for a test result 3 or more days later with a COVID test. Next slide. Ways to create a vaccine. Again, no hope for any time in the near future. I'm personally not optimistic that we'll have widespread availability of vaccines until Q1, at least Q2 of next year. Next slide, please. And this goes into some of the details of the most promising 5 vaccine candidates. I won't go into more details here other than to say that this is going to be hard to prove, right? You need to test a vaccine in a place where there's a lot of COVID going on. So they're rushing to try to recruit people where COVID is going up. Only then will you see, is a vaccine effective relative to not getting a vaccine in preventing spread. And so the numbers are staggering. 30,000 people need to be enrolled for a study. That's very hard to coordinate, very hard to do. And that's why I'm saying, don't hold your breath, be optimistic, but let's wait and see what happens. Be very measured. Next slide, please. A lot of metrics and data. We talked about needs for data. This is a group called Resolve to Save Lives. Former CDC head Tom Frieden is one of the leaders of this. These are some of the 15 metrics he talks about that we need to be talking about and reporting publicly daily at the state and local level if we can. We're doing a horrible job of this. Horrible job. As a nation, we do not have a good reporting system. Even as you've heard the stories publicly about the CDC versus HHS reporting data, we really need to start to think about a fundamentally different approach to this that protects privacy and still allows for public health to do its work. Next slide, please. This is one of the examples of actionable data at the US level for 3,000 plus counties. And it tries to summarize some of the most important metrics of 5 indicators: the daily new case count, the infection rate, how many people are testing positive, how much room do you have in the hospital, do you even have tracing capacity in a state. And this tries to give decision makers easy ways to understand, are you at risk, are you actually in an outbreak, or are you doing well? You can see most of America still has an R0 or RT of greater than 1. They're yellow, orange, or red. Only 2 states have an R0 of less than 1. And so that means that we are not anywhere close to doing well. Next slide, please. I'll stop there and leave time for one question, I believe.
From Stephanie Williams. Stephanie, could you please?
My question was, in regards to the trials, African Americans are traditionally reluctant to participate in such trials. And so my question is, do the vaccine developers have a baseline number of trial participants by race and ethnicity that would be needed to ensure that the vaccine is well tested and viable for everyone who will need to take it?
Yes, that's why you need staggering numbers that I talked about. Is they have to have that adequate plan. If they plan to use that vaccine in those people, they have to justify it.
Thank you so much for your comments, Dr. Shah. I'd like to next introduce Dr. Ashish Jha of Harvard.
More high-level remarks. The first is that America may have the worst response of any country in the world to this pandemic. It's close. You could argue that Brazil, Russia, Turkey, possibly some of the data out of Russia and Turkey are a little less reliable, but certainly Brazil has had a response as bad as ours. But those are the main countries. We're doing much, much worse in most ways compared to Western European countries, compared to Southeast Asian countries. And but when you look at the U.S. response, there are actually two responses in one. Parts of the United States have actually done quite well. They look a lot like Western Europe, being hit hard early, locking down aggressively, keeping case numbers reasonably low. About a third of the U.S. right now is in reasonably good shape, whereas another third is in very bad shape, and in a third, the middle third could kind of go in either direction. So a lot of variation in the United States. Second big point is that it's very tempting when you look across the globe to look for explanations for why other countries are doing better. And I've now done enough of these panels and conversations that I've heard completely opposite theories. One is, for instance, that authoritarian countries do better. Except I started off saying countries that are doing poorly include Brazil and Russia, so that's not really consistent. There are some people who say, well, it's actually cultural and East Asian countries do better. Well, a lot of East Asian countries have done very well, but so have certain European countries. So I don't believe that there is something kind of inherently cultural about certain countries' responses or their people that makes it easier. So seriously the virus has been taken. We have had an incredible amount of misinformation spread often through social media outlets like Facebook. We've had a political and leadership, both at the federal level and at many state levels, that have largely adhered to that misinformation and promoted that misinformation and have failed to take science as the primary guiding principle. Look, it's a pandemic with a virus. And so this is almost all about biology and math. And if you decide you're going to ignore both the biology and the math of this virus, it is unlikely that you'll end up doing very well. And that's what we have seen pretty consistently. Third big picture point is that you don't have to be a wealthy country to do well. And if we had been doing this session a few weeks ago, I could have made the case, and I'll still make the case. But 3 or 4 weeks ago, I would have said Vietnam, one of the kind of absolute standouts, has not had a single death. Well, in the last couple of weeks, they've had a couple of large outbreaks, and now they have had a few deaths. But it's still trivial compared to what has happened in the US and in many other places. So does Vietnam have access to some therapies that America does not? Nope. They don't have any new special diagnostics. They certainly don't have a vaccine. So what is different about Vietnam, what is different about Taiwan, and let's talk about Vietnam because it's not as wealthy as Taiwan, is that fundamentally they have taken a very aggressive approach to this virus. They shut down their travel early with China. They've screened people coming in. They've had a very aggressive contact tracing regime. So there's a lot that Vietnam has done well to keep the virus under reasonable control. What's important is that the Vietnam approach is actually pretty different than the South Korea approach, which has really relied heavily on testing, which is pretty different than the New Zealand approach, which has relied largely on lockdowns, which is pretty different from the German approach, which has been this blend of many things, which is also different from the Japanese approach, where they haven't done a ton of testing, but they've had universal masking. So what's my point? My point is there is no one way to deal with this virus. There are 4 or 5 major tools we have. You have to deploy at least one of them really, really effectively, and the others become a supplement. You can almost pick which one you want to deploy. In the US, we've done a half-hearted approach to a whole bunch of different things, politicize things that clearly have no basis being political, such as whether people should wear masks or not, and have had a whole lot of misguided, non-science-based policy implementation that has landed us where we are. So let me just finish off by saying, as I look to the future, the weeks and months ahead, the fall, the winter, into the spring of 2021, and I agree with Dr. Shah, by the way, that we will not have a vaccine that's safe, effective, and widely available in 2020. I think that is highly, highly unlikely. But in 2021, we might. I mean, we will in 2021. I'm pretty confident, and we will. My hope is in the first half of 2021, but not necessarily much.
Schools will remain closed. Their schools are, whereas private schools are already opening with testing strategies in my neighborhood, a few miles away from me. So it's a few miles can make a world of difference, and we're already seeing the bifurcation of the kind of normal where people who can work remotely are told you're not coming back for the next year, but you're working and you have a job. Other essential workers are forced to put themselves at risk and are dying disproportionately.
Absolutely. Dr. Jha?
Yeah, I'll add to what Nirav had to say. I think that so what does normal look like? Normal is not what life looked like a year ago, but I think there are key elements of our lives. I think kids will be able to go back to school relatively safely next fall, not this year. I think we have a whole year of difficulty ahead of us, but I am optimistic that next fall things will look much better. I think we'll be able to gather together. We could have this kind of an event in person a year from now. By the way, that's a very optimistic view. It's an optimistic view of timeline of the vaccine. It's an optimistic view of the efficacy of the vaccine. I am very optimistic about the vaccine and where it's going. But that all requires a lot of work and a lot of distribution. One of the misunderstandings that a lot of people have is that we'll have a vaccine and then somehow the pandemic will be over. That's not quite right. It will get distributed. It will slow things down. Things will improve in the spring into the summer. And the questions that will remain, life will look very different post-pandemic. And there will be important questions about what are things that we used to do all the time that we just will decide we don't want to do anymore. And the only other point on this is when you look at any major pandemic, any major disease outbreak, it always changes societies in very profound ways, but it's often hard to predict up front and really easy to see in retrospect. So in many ways, it'll take us years to really fully appreciate the profound effect that this pandemic is having on our society.
Thank you so much. Dr. Nguyen.
Well, first, I agree with Dr. Shah in the sense that disparities are just going to get worse. I don't agree necessarily that things are significantly different than from before. In other words, disparities have always existed in this country, and most of us allowed ourselves to not look at it. And the pandemic has basically, I call the pandemic a major stress test on all American systems, and we have all broken down. And so now the disparities that we're seeing are definitely going to be worse, but it is very clear that we had this before, and we were able to ignore a lot of it. So the future is bad, but the past was not good either. So that's one thing. The other thing is I'm not as optimistic about getting back to normal.